so we've come to the end of the session. Thank you very much to all the presenters. And we're finishing off with a bit of a discussion. Tony, at the end of his presentation, projected a question. Okay, and the question, as it's put on the program, is if we had to provide scalable health service interventions to improve quality of life and outcomes for children, both with disabilities and long-term health conditions, what will be put in the box? Okay, so how do we build that system of support for children with long-term health conditions and disabilities? And we've heard an array of presentations of many, many conditions that fall under these umbrella terms. And so if we had to try and address it at scale, what do we need to do and put in place that's missing or not there? And then what do we need to do better, or where do we fill the gaps? So I will fill.
Well, I think the first thing is that we don't know what is actually happening in the different provinces. It's very evident that there's little pockets of information, but it's not coordinated, not integrated. Nobody knows. And there is now a strategy and framework for disability and rehabilitation in South Africa, which was compiled without any consultation of any of the provinces, and I just don't think it's viable, because you can't plan if you don't have the data.
Thank you. So are you saying we need information? Because I think I'm looking for solutions. Like, I think we've articulated a lot of the difficulties, but if people can come up with ideas or how to move the agenda forward, that'd be helpful as part of your problem identification.
I think over the course of the last few days, and especially yesterday, the role of the community healthcare worker was highlighted. And I feel perhaps not in as much detail as there could be. And I think that empowering those community healthcare workers, more resources, better pay, I think that would go a long way in strengthening our community outreach and providing better healthcare. I think someone mentioned that a lot of the time they also only work half day, they don't have transport. So there's lots and lots of these problems that we could look at to help overcome those.
Just in terms of the integrated ECD policy, there's also a particular focus on disabled children, and I don't know the detail, but I do think that one needs to look at that avenue as well. You probably have already, but I do think it's something that this has died on us, so there we go. I think that's something that one could explore. And what in particular, again, coming back to the broader conversation, I think the support for a primary caregiver in general is essential. And I think my experience of the CADA, the tribe that has spoken last, is that they're particularly good at the strength-based approach for parents and pulling out strengths of families. And I think we need a generic approach to that overall, not only for long-term health conditions. So not that I want to take the focus away, but I think if we couched it in a sort of the front line of a broader move to support primary caregivers and link that with our integrated ECD policy, perhaps if there's leadership in that space, we can articulate better what that springboard gives us potential for.
I think if you look at specific long-term health conditions, I think one of the main obstacles is for everyone to come around the table. If you look at the package of care, say for Down syndrome or for whatever long-term condition, because my experience is people is really in different silos, and different people don't know what other people are doing. So I think the first obstacle and the first thing is if you're looking to develop a package of care for a specific condition, is to get a forum or to get a platform. Try and use established platforms that's already in place to just get everyone that's involved in the care of this condition to sit around one table and to discuss the issues. And if you don't do that, you're going to just bump over lots of obstacles. So that will be, for me, will be the first thing.
I know that Tony's already been working on something like this, but beyond the Road to Health book, there's like a gap when it comes to chronically ill kids. So a book where you could have all the information that's necessary so that if the child goes to another health system, the stuff is not repeated, but also a book that the family can understand so that it really helps with continuity of care. And included in that book, care planning and advanced care stuff as well.
Just in terms of our NPOs, I think we should really, as part of the solution, it's really to strengthen our NPOs. I think we have a lot to offer, as Gillian mentioned earlier, but that in terms of accountability and transparency, to put structures and monitoring systems in place in strengthening NPOs, in really being the hands and feet of our health system.
And so I'd like to add to that, and also to the suggestion of networking of the people who are involved. I've got my tribe hat on again. Those networks absolutely need to have nurses in them. I think the invisibility of the work of nurses, like how do you persuade a child to drink rifampicin for 6 months, and all the other things, if those things, if nursing practices are not in that package of care, even in PAC, like in IMCI, they're missing, and then they sort of get lost, and we understand why our graphs go down, or maybe we don't.
Also to remember that our primary clients are the children, and that we need to develop and create platforms to listen to them, and in whatever way we can. So the voices of children in how and their take in how we deliver the services that we provide to them are essential to improve and to expand those services.
I think a lot of our trainings are still in the survive mode. We've got ESMO-E, we've got MSSN, we've got ETAT, we've got HPB, and I think we need to develop a training package which deals with, like Mameta's been saying, how do you get someone to swallow Kaletra syrup, and how do you counsel someone, and how do you talk to adolescents, a more longer term type of package, so that nurses, and I'm talking again from primary health care, often a clinic only has a handful of children with certain conditions, but that people can go on these courses and not just your acute management of conditions, and that they can then manage those patients over many years, and many of the nurses, they're intricately involved in these families, and I think they're best suited to do that.
Hello. Yeah. First thing, I think for me, one of the things that we are not doing well is to have a local database of children with long-term health conditions. Because I think if we can know exactly and have a local database, and also to know the NPOs that are supporting those special conditions, and just to do a map up to know who's doing what. I think the NPO coordination, it becomes very important at either district or provincial or hospital level, so that you can actually know who to refer to. And again, the training, I think training shouldn't be just training. It should be a training with mentoring and with support from somewhere, and also as healthcare workers to develop those clinical forums where we can actually discuss these long-term health conditions, so that everyone is capacitated in any level.
Any other speakers would like to respond to any of these from their personal experiences or?
One of the quite big things that my program is involved with is getting the equipment to send the children home. So I see that this little child is in a buggy on the screen here. You know, that's an essential piece of equipment for children to go home. So I think we need to take into consideration not only the medication and things like that, but also the equipment to make their lives good.
think what we've have seen here is how much is going on. We need to bring it together. I can see that we just need to know each other's tools. We need to use everybody's learnings to become everybody's learnings. So what Yaku might be doing and Chris might be doing, that idea that we come together, and whether they're generic tools or specific, that we find some mechanism to learn. I just was blown away by that geographical map there. That's what I've been wanting to do in Cape Town for ages. I have a register. I keep it myself, but I don't know exactly how it looks. And then I can't talk to the primary healthcare people about where they need to be doing whatever they're doing. So there's just so much that we need to draw together and package in a way that is available to everybody and becomes part of Essential Package.
Okay, thank you everyone. I think it's time to wrap up before we hand over for closing remarks. So I'm going to have a couple of reflections because now my time as chair is coming to an end. I'm allowed to speak. So as the presenters were coming up, I didn't capture all of Tony's C's, but I think many of them are encompassed in my list. So I've got about 40 things that I've jotted down as people were speaking. So there's about 40 points that need to go into some kind of planning, a system. For me, it's 3 things. Okay, so when we talk about transform, the way I think about it is we have to transform our thinking. Okay, so our psyche, using Barak's terminology. So we have to transform the way we think about delivering child health care. And that all of these things we talked about today, whether it's a child with a developmental delay or disability or long-term health condition, that needs to be as part of the package. Okay, it's not something separate, it's part of the package. We heard so much about mental health, but at the moment it's not part of the basic care package. And so if we start there, and how do we change that? It's through not only in-service training, but the way we train pre-service. And breaking down these barriers and getting people to talk to each other. It's astounding how even professionals in one ward would not talk to each other. So I think all of those things will help to transform the way we think and approach children in terms of our interactions with them. That way it will contribute to many other ways as well of transforming services. And I think that needs to happen as well, so that we can be flexible, we can be adaptive, we can respond through a tiered system. And I think Chris put up a slide of a tiered system. My vision of a tiered system is slightly different. We've talked a lot about the children at the top of the pyramid. The children need the very complex, high-intensity interventions. But children move through a continuum of services and need as they age and they grow older. And we need to be able to adapt to that. And we need to be able to do that through supporting relationships, environments of relationships. And then lastly, we have to transform the system. And at the moment, we don't have a system that clearly articulates what's needed. We don't have a system that creates enabling environments and allows strong intersectoral collaboration and partnerships. I think it's more about partnerships than just working together, because that's where we start looking at the humanness of people who are delivering services. So just to wrap up, I think we've talked about a very pertinent issue, but one that perhaps doesn't get a lot of airtime because it is regarded as being as top of a pyramid and a kind of a grey, fluffy area that we're not quite sure about because we don't know what we're dealing with. But we've heard lots of ideas about how we should approach it, and hopefully going forward we'd try and come up with a coordinated approach, as Tony was saying, to try and work out and problem solve collectively.